Welcome back, everyone. We're here with another show, Q&A, anything related to the ketogenic diet or nutrition. Anything I say is not meant to diagnose or replace your medical care. Check with your competent doc to double check to make sure that these things that we suggest align with your program. Thank you. Steve, let's dive right in. There's a lot of people lined up for questions.
Absolutely. We have a huge continent of admirers, India, and Akash from YouTube. You share a great many weight loss videos, but not on weight gain. In India, many young men are underweight. I'm a 23-year-old vegetarian. Please share your advice in the video or here on the air about gaining weight, and he thanks you.
Well, it's very simple. All you do is take my weight loss videos and then just do the opposite. No, I think if you want to gain weight healthily, you're just going to have to increase your calories, and you're going to have to add more heavy weight training to stimulate those muscles so they can hypertrophy and get bigger, because obviously you don't want to gain fat, right? So those are the two things. Bigger meals. I would still do no snacks and maybe just 3 meals or 2 meals. Just try to increase more calories, and then you don't want to be like a sumo wrestler where you're taking a lot of naps, consuming rice and drinking beer. But I think the way that I mentioned is probably going to be the healthiest.
Excellent. Good luck with that. India. Sharon from YouTube. I'm 63 and my hair is thinning a lot in the front. Is this possibly a side effect of my hormones changing? What are your thoughts about hormone replacement therapy? Are there better alternatives?
So there's some really interesting things about hair loss. There is a hormone that's in your body that as we age, it does go higher. It's called DHT. It's a very powerful form of testosterone. And this happens in men and women. With men, they do get receding and then they get thinning in the hair in the top part. With men, they definitely lose more on the crown. And this has to do with that more powerful form of DHT. Now, there's a lot to this, but I'm just going to give you the summarized version. You can watch some recent videos on this, but if you look at someone that's actually balding, the head is a bit shiny and like there's no hair there, and so people are trying to get their hair back. But what's happened is there's scar tissue going on in the actual factory that hair sits in, and it's called the follicle. So the follicle is kind of like a little pocket that gives hormones and nutrition, blood flow to the hair. And then when that starts to get damaged because of too much DHT, and then the hair starts thinning and then it stops growing. And then so there's a lot of different medications people use that are inhibiting DHT. They're enzyme inhibitors, but there's also some natural ones. And you can learn about that. But when we're dealing with actual hair loss, some other things you might want to know about. Number one, microneedling to actually stimulate and break up the scar tissue on the scalp, and maybe some aggressive massage to stimulate or break down the scar tissue with one of the best oils, which is rosemary oil. So that seems to be the most researched on that. And then you can also use a very specific grow light with a red light. Red light stimulates the mitochondria in that tissue. And so there's a couple combinations of things that you can do to really boost your hair. But of course, one real simple nutrient is zinc, because the hair needs zinc, and that can also inhibit DHT. But anyway, there's a lot more to this. I just gave you the quick summary.
All right, very good. Well, good luck with that. And next one is Nazim from YouTube, and this sounds troubling. Why would a young child get bluish skin and short of breath when exercising or running? Didn't say how old, but...
Well, you definitely need to do a deeper evaluation, because that is not normal, and that is there's some type of severe lack of circulation somewhere. So it could be any number of things. But yeah, when you start turning blue, it's time to kind of get a nice evaluation by a competent doc that can look inside and see what's going on.
Yeah, good luck with that. Don't mess around with that, for goodness sakes. All right, let's go to Nathan from Facebook, what's the best way to gain muscle and lose fat at the same time? I guess you kind of touched on that, but there you go.
So when we're dealing with that situation, we have a combination of things. You have diet and exercise, right? So diet is going to contribute, about 85% of that. And then exercise, that 15%. So just so you know, diet's going to be super important. So you want to start cutting down the carbs. You want to make sure you have sufficient animal protein. There's other things you can take, like creatine monohydrate, which is something to kind of help the muscles get bigger and give you more energy to work out. But a good workout plan that addresses the muscle intensity and add more volume to your workout. I'm not talking about 60 minutes every day, but maybe like a 40-minute workout doing weights and resistance training with the low carb will give that muscle a chance to break down, stimulate, and then adapt by getting stronger. And then you have this improvement over a period of time. You just have to make sure you don't overtrain, and then that'll stop your growth. So the whole purpose of exercise is to cause an adaptation to your muscles. So there's a whole technique to it. You can learn about that and then apply that with the lower carb, and that way you can kill two birds with one stone: lose weight and gain muscle mass.
All right, very good. And from YouTube, what's the best supplement regimen for a young teen with multiple allergies?
Well, we're dealing with the immune system, so we want to strengthen. Colostrum would be good. High doses of vitamin D3 would be good. Selenium would be good. Don't forget the magnesium when you take vitamin D. These are all important things to build up your immune system. Our immune system has to be. There's a part of our immune system that our mother has given us, and that's kind of the innate immune system. But then we also have the acquired immune system that develops through getting sick and then having our immune system get trained from that. And so early on, if you put a child in a too sterile environment, they don't really develop as well compared to someone who's like living on the farm where they're exposed to all sorts of germs. Boy, they really develop a robust immune system. So one thing I would recommend is play in the dirt more if you're a child and develop that immune system. And then when you get sick, don't immediately try to suppress it. If you get a fever, let it take its course, let it go through the process, so that way you can come on the other end and have a stronger immune system.
All right, very good. Christina from YouTube, please discuss how we can help our metabolism during menopause, and she thanks you.
I'm going to release a video on this. There's some really interesting things that happen with menopause. There's a big drop in estrogen, and there's some interesting things that relate to your metabolism when estrogen goes down. What happens is insulin resistance becomes more of a problem. So that would explain why your diet during menopause needs to be even cleaner as far as lowering your carbohydrates. The second thing that happens with the decrease of estrogen is you no longer have the efficient activation of vitamin D. The receptors for vitamin D don't work as well. So you need to increase vitamin D, which directly and indirectly helps your metabolism. So those two things I would recommend as a quick tip until you can watch my complete video on it.
Okay, well, we have 5 terrific questions today. 3 of them are easy peasy true falsers, but you're going to have to work on this first one because it's asking you to answer, and there it is, Doc.
Okay, regarding the junk food ingredient maltodextrin, what is its purpose in food?
All right, climb on that, folks, and let's go to Raina from Facebook. Raina from Facebook. I have PCOS as weight training recommended.
So polycystic ovarian syndrome is a situation where a female starts increasing more androgens, and so they get facial hair, midsection weight, sometimes a deeper voice, sometimes hair loss because of that DHT, which is a more powerful form of testosterone. So the thing that you need to do is go on a low carb diet with intermittent fasting, so you can then lower insulin, because when you increase insulin, that will automatically increase more androgens. So that's going to actually help you more than anything. And I completely forgot your first question. Did you ask that weight loss, like exercise, or what was it?
Yeah, I wanted to know with PCOS, is weight training
Oh,
appropriate?
I think it's going to help you a little bit, but I would highly recommend going on low carb, because it's like a 1-1 relationship. If you have PCOS, you have insulin resistance, so you have to fix that. Yeah, going on weight training will help you a little bit, but it's not going to be the big heavy lifter on this problem.
All right. Well, this crosses all gender barriers. Danny, in this case from Facebook, please help me with chronic constipation.
So did it start, recently, or has it been going on for a long time? If it started recently, find out what you did and revert, going back to any change that occurred, because it's so interesting. Like, unfortunately, a lot of docs don't really kind of like, okay, when did this start? What happened just before it? Okay, that gives you a clue, and that way we can use common sense on that. But if it's been going on for a very, very long time, there's several reasons for that. One could be related to the colon has been atrophied because you've been eating incorrectly, or maybe eating too frequently. I think a really important thing to help constipation would be to do intermittent fasting. And if you look up constipation, what do they tell you to do? Start increasing your fiber. Not necessarily. Why? Because first of all, fiber attracts water and it bulks things up. You're already bulked up. I mean, why would you want to add more clogging to the plumbing? You wouldn't want to do that. So I would go maybe carnivore. This might surprise a lot of people, but even when I started doing more meat and less fiber, but of course I cut out grains too, I thought I would get more constipated. No, actually my bowels worked a lot better when I actually ate more meat. So meat has glutamine, it supports the gut. You might want to try it. It could help you.
All right, very good. Let's see. Quiz question number 1. Let me bring that up for the audience. And it asked, regarding the junk food ingredient maltodextrin, what is its purpose in food? And 65% of respondents said it's a filler, 20% say it's a flavor enhancer, 10% say it's for adding texture, and 5% say it's a sweetener or addictive agent.
Okay, good. So, when you deal with real food like protein, it's supposed to repair your body. You can even use some of it as fuel. But when we're dealing with the ingredients in junk food, it's really interesting to look at the purpose of it, because the main purpose of maltodextrin is to add bulk, to use as a filler. Like, wait a second, what are they trying to fill? Well, you're trying to bulk it up because it's so empty. You got to add something in there. So it has literally no other purpose than to add as a filler. And when it's in the first or second ingredient of certain products, what are you actually consuming? You're consuming industrial dust. It's a waste. It's kind of like a waste product from corn, completely so cheap. I mean, 1 pound of it is literally right around 22 cents a pound. So you're dealing with something that is not inert or non-reactive. It's deadly because it spikes your blood sugars more than sugar, and it's not even sweet. And it's added as a filler. And so really the purpose is to solve the question, how do we make the cheapest food humanly possible? Add maltodextrin, and then you got it.
Wow. Okay, let's go to our green room, and we're going to go to Georgia, where we have Farah on. Farah, go ahead with your one question for Dr. Berg, please.
Hi. Um, it's sort of a combo question, actually. I'm trying to work back into intermittent fasting, but I'm having a hard time with knowing what things I could actually take while I'm doing intermittent fasting. I'm sorry if I look like I'm turned sideways, but um, Like, can I take the amino acid L-lysine? Would that break my fast? And then also, like drinking coffee, I can't drink coffee black. So, what could I add to coffee that would make it better, but not break my
Hmm.
fast?
Very good question. I think, yeah, when you actually add any of the amino acids, it will break your fast because you're trying to create all these cool effects when you're fasting, and especially protein that will break your fast because. But I know what I know what you're saying though, because you're probably trying to feed your muscles certain amino acids that prevent atrophy, and L-lysine is one of them. It's the biggest one. But this is what I would do if you do prolonged fasting. I think if you don't feel that great on it, or you feel like you're losing muscle, maybe have bone broth. Maybe that might be a good solution because it's very low calories and it's not going to break your fast for very long. And this also goes with the coffee. I cannot drink black coffee. I need some cream in there. So I would just go for it and I wouldn't have half and half. I would do whole cream because that way you get less of an insulin spike, and you're having such a small amount that it may break your fast just for a tiny bit, but then you go right back into it. So it's kind of going to be insignificant. You're dealing with probably a tablespoon, right? That's about it. So that's what I would recommend.
That's great, Farrah. Thanks for calling in from Georgia, and hope you enjoy the rest of the show. Okay, let's go to Ida from Facebook. How to best address hand tremors.
I'm going to do a protocol on this because there's a couple reasons why people get tremors. Now, if you have Parkinson's, you have a problem with a neurotransmitter that's causing it. But that's a whole different thing. But there are natural ways to increase these neurotransmitters, and I've done videos on it. But let's say you don't have Parkinson's and you get this resting tremor. Higher amounts of B1 will improve this, it's called acetylcholine, that potentially could help that condition. I've recommended it to a lot of people and they seem to do very well in it. So in addition to getting your body to run on ketones, I would recommend high doses of B1, natural B1, and try that and see if it doesn't help you.
All right, very good. Let's go to Haneza from Facebook. What's the one best nutrient or food I should include daily to reduce inflammation in the body?
The two things you want to worry about with or think about with inflammation is, okay, first of all, what's causing it? Are you doing seed oils? Seed oils tend to give off a byproduct, which is like this molecular super glue. It's called aldehyde, especially when you heat it. You know, and also refined carbs and high fructose corn syrup and all those things. And even like excessive iron can cause inflammation. But if you're looking at things to reduce inflammatory conditions, there's some fascinating new information on especially inflammation in your joints. You probably heard of the gut-brain axis. Like there's a lot of things that you can fix in your gut with your brain. There's also another axis called the gut-joint axis. So specifically supporting the microbes in your gut that help manipulate or modify bile salts. Yeah, bile salts. There's receptors in your joints for bile salts. And so if you take a look at people that eat things that destroy your microbiome, like especially the emulsifiers in the ice cream, the sorbets, the sauces, you want to stay away from like polysorbate 80, for example. That would be something, or carrageenan, and stay away from those because they really mess up your microbiome. And then also, if you notice when people take antibiotics, they end up with a lot of inflammation afterwards because they're destroying the microbes that are involved in the bile. So anyway, to help you with inflammation, I would consume foods that are fermented, like kimchi or sauerkraut or even kefir. That'll probably be your best bet. You know, in addition to omega-3 fatty acids from fish oils, but a really good remedy for arthritis, for example, is TUDCA. I've talked about TUDCA for other things, but apparently it goes way beyond the digestion of fats, and it helps protect the nerves in your brain, but it also protects your joints. And you want to take it too on an empty stomach twice a day. And I found some recent research on even people that have bone-on-bone knee pain. Taking TUDCA can at least give them some significant relief.
Wow, that's encouraging. Let's go to quiz question number 2, Doc.
True or false? People who react to the A1 milk protein have an allergy to milk protein. Now, some of you are like, what are you talking about? Well, I don't know if you've ever seen, like, they sell milk, like A2 protein milk. Maybe you haven't seen that, but most of the commercial milk is A1. It's a type of protein. And the question is that true or false? Is that that is a milk allergy? And then true or false?
All right, very good. Let's go to Esma from Bosnia on Facebook. My husband has high blood pressure and a very high pulse rate of 109. I guess that's resting. He's also has diabetes. He struggles with sleep apnea. How can he naturally regulate and lower his blood pressure?
The foundation problem of blood pressure is fixing insulin resistance, because the insulin resistance, you're literally starving off the blood vessels with nutrition, and they stiffen up, and then the pressure goes up. So you obviously need to go low carb, doing intermittent fasting as a immediate thing. But the other thing that is involved in keeping the arteries nice and flexible and soft is potassium. So we want to go way up on the potassium, because that's going to be really important as well. And then, of course, vitamin D and magnesium are the other two that will help lower the blood pressure. But if you have a pulse rate that high, it tells me that your body is compensating for some lack of oxygen somewhere. So we definitely need to fix the root cause. But as we're fixing the root cause, insulin resistance, we want to add these other nutrients in there to get some quick results.
All right, Esma, we're all pulling for your husband in Bosnia. And speaking of Bosnia, let's see who else is listening. So we'd like to say a good day to all of our viewers joining us today from the UK, Canada, Mexico, Greece, Bosnia, there we go, and Herzegovina, excuse me, Jordan, Albania, South Africa, the Philippines, Qatar, Finland, Ethiopia, the Bahamas, American Samoa, the Netherlands, Australia, Poland, Japan, Ukraine, New Zealand, South Korea, excuse me, it jumped. Switzerland, Israel, Pakistan, Egypt, Trinidad and Tobago, India, Norway, Somalia, Myanmar, haven't heard from them for a while, Jamaica, Denmark, Nigeria, Italy, Moldova, Turkey, the Virgin Islands, Chile, Brazil, France, China, Brunei, Eritrea, Bangladesh, Ghana, Peru, Singapore, and all across the United States. And of course, anyone else wants to chime in late, we would love to acknowledge you. Thanks so much for that. Let's go to our old friend Sadow10 from Rumble. What's the best way to recover from a thiamine deficiency, and how long would it take to get back to normal levels?
Well, then you start taking thiamine. I would take the natural version of thiamine. Now realize that thiamine needs also magnesium to work, so I would also add the magnesium in there, and that way it'll actually work. But yeah, start taking it, and how long does it take? I don't know. It could take some weeks or months, depending on how deficient you are. But some of the symptoms of you have early symptoms of a thiamine deficiency, and then you have later ones. The earlier ones are this nervous anxiety, this nervous tension that you have, that you're just like on edge. You lose your tolerance for driving behind slow people for more than 20 minutes. You lose your your tolerance to drive in traffic around the belt on DC. Like, you just can't deal with that. You also lose your tolerance babysitting any more than 16 small kids in a room for over 8 hours.
Ugh.
So that's, you need more B1, and then the later symptoms are more nerve damage to your feet. So it's called peripheral neuropathy.
All right, let's go next to Moon Fairy from YouTube. I have late onset psoriasis on my body and I'm getting UV treatment, but I have a very hard time getting rid of it on my scalp because I have very thick hair. Please help. That sounds awful.
They may have an option where you're doing some topical vitamin D on your scalp. That's an idea. But you need to start taking a lot more vitamin D. Just consume it. And to the point where you're flooding your tissue so much with vitamin D that you have enough to penetrate and to help your immune system get back in order.
All right, very good. RX13 from Rumble. Would it be safe to increase my vitamin D3K2 intake from 10,000 units to 30,000 to address fungus on the pinky toenail? No other health conditions are present. That's good.
I think it'd be fine. Make sure you take the magnesium and the K2, zinc as a cofactor. And then, of course, my disclaimer is any of these recommendations you check with a doc, because if you find a doctor that actually understands, which is rare, vitamin D using high doses, I think there's probably 4 of them in the United States. They're going to check your parathyroid hormone. They're going to look at that because that's kind of like a backup to vitamin D. So when you're low in vitamin D and now you can't regulate calcium, the parathyroid gland goes up and it starts to pull calcium out of your bone, because calcium apparently is really, really important for various reasons. So they'll check the parathyroid gland. They make sure you don't have too much calcium in your blood. But if we're talking 30,000 IUs, I don't think there's going to be a problem, especially short term. And then just check your blood levels as well. Ideally between 60 to 80 nanograms per milliliter is a perfect range. But when it gets down to like 20, you got a problem.
All right, very good. Now, this is something I think we need to clarify for the audience. And Chanel for Lynn from Rumble asks, while doing an extended fast for 3 to 5 days or even 21 days, will consuming fat and fiber break the fast?
So fiber won't necessarily break the fast, but you wouldn't want to take fiber. I don't know why you would want to take fiber. Fat if it's of a significant calories, it's going to break to a fast depending on how much fat you have. There's always these gradient levels of quantities of things. So, a tiny bit's not going to be an issue, but if you start adding more, it's going to be an issue. But you can take supplements when you're doing prolonged fasting, but here's the thing with prolonged fasting. Some people feel really good with it. Some people feel really bad with it. The people that feel bad with it, maybe they haven't adapted and slowly worked into it, or maybe for some reason their body just has not adapted for another reason, in which case I don't want you to do something that you don't feel good with. So maybe you want to, for that case, adding in some bone broth can give a person a tremendous amount of relief and allow them to fast longer, because what they're really missing is the protein.
Interesting. Okay, well, good luck with that. And we're going to add a few more shout outs to other viewers that just said, hey, how about us from Hungary, Ireland, Belgium, Uruguay, Puerto Rico, Austria, Panama, Iceland, Rwanda, Belize, Sweden, Guatemala, Iran, and Romania. Boy, what an audience. That's terrific, folks. I'm glad you're all joining, and we'd love to acknowledge your patronage to the show. Cambridge from YouTube, would it benefit men to go on the carnivore diet when they have benign prostatic hyperplasia or even prostate cancer?
I knew someone was going to bring this up. I can't actually answer that. I am going to be coming up with protocols, like specific protocols, depending on what type of cancer you have, of what to eat. One thing that's really missing in healthcare is the attention on when you get cancer, what do you eat? Because they'll say, oh, it doesn't matter. Really? It doesn't matter what you eat? That does not make sense to me. Should you go on a low carb? Should you go on a high carb? Well, definitely not high carb, but cancer can also consume certain protein amino acids, okay? So cancer adapts to whatever you're eating, and it will find a way to get some type of resource. So this is why the most beneficial thing for cancer is prolonged fasting, right? Because you're completely starving off all the resources. But then what do you do? Well, then you maybe do one meal a day, but then what do you eat? That's the topic that I'm going to have a document on, because what might be good for one, or diet for one cancer is not good for another, because they're very different, and that adds a lot of confusion. I would watch my videos that I do have on Rumble, because YouTube for some reason won't let me do too many videos on cancer.
Yep. All right. Very good. Linda from Facebook, what would you recommend for people with gastroparesis? Did I say that right?
Yeah, gastroparesis. What
Paresis, thank
happens
you.
with that is the digestive system is slowing down because the autonomic nervous system is messed up. And so that's one of the side effects too from Ozempic. So how do you reestablish that? You need to go up with your vitamin B1, the natural version of B1, start taking more of that to help fix the autonomic nervous system.
All right, Bill from YouTube, which nutrients are allowed during an extended fast? I guess we kind of covered that, but how often should ox bile be taken? Is that a no-no, or is that like?
So if some people, when they do prolonged fast, they might, they're not eating, so they're not getting that release of bile from the gallbladder. So it may potentially build up, and it could be a problem, in which case you'd want to take like some bile to help maybe thin the bile if it's too concentrated, if you start feeling a full sensation underneath your right rib cage. So I think TUDCA would be a good one to take 2 on an empty stomach, maybe once a day. But most people are not going to have a problem, because when they start fasting, they're not eating. And so there's really no trigger to make bile at that point. So whatever you have in your system kind of just stays in there and just waits until you eat. So the liver is not getting instructions to make bile. So then that should slow down in theory. So anyway, most people are not going to have a problem with that.
All right, very good. And people didn't have a problem with quiz question number 2. We have the answer, true, false. People who react to A1 milk protein have an allergy to milk protein, and 55% of respondents say it's false. The other 45% say that it is true. Who is correct, doctor?
This is interesting, because I assumed that was an allergy, but it's not. It's an intolerance or a sensitivity, which is different. It can mimic allergy symptoms, but it's not a true allergy to this milk protein, which is fascinating, because if it was, then they can eat the A2 protein and they would have the same reaction, but they don't. A lot of people just switch to the A2 and they don't have a problem. So what is A2, A1? These are just very similar proteins, but with just one little tiny change that then causes something to react in the body. That change occurred, it was a man-made change. Okay, so that makes more sense. So if you consume milk products from a goat or a sheep, you're not going to get the A1, you'll get the A2. And there are certain cows that have A2 milk, and you should just consume those as far as their byproducts, like the cheese and yogurt and things like that. And you should do a lot better. But the A1 milk, especially if it's concentrated into an A1 milk cheese, usually, mostly always from grain-fed cows, then people have these allergies and not allergies, but these reactions in their digestive system. But there's also a couple even worse things that you can do. When you buy the protein powders or certain non-dairy creamers, it has in there sodium caseinate or calcium caseinate. That's a super concentrated A1 milk protein from casein, which it's way worse than the actual milk because it's super concentrated. So anyway, this is why, Steve, we need to read the ingredients and stay away from certain things.
Boy, there's a lot of homework to do, but it's worth it. Let's go to quiz question number 3.
Okay, true or false? Osteoarthritis is merely a wear and tear type arthritis.
True or false, audience? Okay, let's go to Dana from YouTube. What's the best way to get rid of an get rid of a 7 centimeter cyst on the ovary? I'm considering adding your sea kelp, but how long before I get any results?
Definitely iodine, anything related to iodine could help you, because iodine helps to regulate the excess estrogen problem that's usually causing that. So iodine is the secret to that. The same thing with a cyst on the breast, is fibrocystic breast, or a cyst on the ovary, or a cyst on the uterus. What you're doing is you're regulating estrogen with the iodine. And then, of course, avoid things that will increase estrogen. So if you took birth control, for example, that could spike your cyst, even, or even that casein, that milk, right? It's because it has certain hormones in there. So, but iodine should make it go down. I don't know how long it'll take, depending how big it is, but in practice, I've seen very large cysts shrink down with just a little bit of iodine over a period of time.
All right, let's take a trip to our animal world where Celtic Dragon, we're not talking about him, but he's writing in from Rumble. What supplements or treatments would help our dog who is losing hair from constant scratching and biting of his skin? Would adding vitamin D or magnesium to his food help? Can you cross the doggy barrier with your stuff?
Yeah, from all my years as a vet, no, I'm just kidding. I think it sounds like a serious itching, which could be more liver related, which could be, usually you got to look at the food, the diet. I would change the diet from that animal. I would change the dog food. Unfortunately, most dog food is dog food. It's like really bad. It's ultra processed food. I mean, I did a video on this. The first ingredient is like wheat. I'm like, what? That's usually the majority of the calories. So you're gonna feed your dog this stuff, and there's gonna be liver problems and other issues. So change the dog food to something that is higher quality, involving organ meats without all these additional grain products, and then see if that itching doesn't completely clear up.
All right, very good. Trish from Rumble. I have pulmonary arterial hypertension. I have been treating it naturally with oxygen therapy and 36-hour fast. Good for you. Can you share some insights on why my oxygen levels are so much better when I'm fasting? That's interesting.
Because every health marker, every biomarker that has to do with survival and repair and maintenance improves when you stop eating, which is it is bizarre. It's like wild, but our bodies are like that because we have adapted in an environment early on where we didn't have a lot of food. So if we just go back to what our bodies were designed or created in this environment, and we're going to do much better. I don't think in the caveman times or at cave woman times they had, you can just call and order a pizza 24/7, Steve. I don't know. What do you think?
Rotten time to be alive, I can assure you that.
So it's just going back to intermittent fasting, and it produces miraculous. Every health marker improves when you fast. I mean, it's wild.
Well, that's incredible. Well, I'm 24 each day, and I love it, and I ain't changing in spite of my lack of discipline previously. Let's go to our next guest, who is coming to us from the UK. It's Delia, if I said it right. Delia, go ahead with your question for Dr. Berg.
Hello. I have a 3-month-old baby, and we found out that he has cow's milk intolerance. And my question is it any way that we can treat it and help the baby to outgrow that intolerance faster? And also, is it any root cause of the problem? I don't know.
So you're breastfeeding though, right?
No, I'm trying to breastfeed. I took a lot of supplements, but I can't fully breastfeed him. So I top up with awful formula, which is based on corn syrup. Disgusting. That's why I want to help him.
Yeah. You need to Weston Price Foundation has a infant formula that you need to look up and research and use that, because the corn syrup is not going to be the best substitute. If I were a part of your family, and if I were you, what I would do is try to call a local, it's called the Leche League, and try to find some local women that have extra breast milk and do that. I recommend that for various women that had a similar problem, and these kids did fantastic they did very well, because the breast milk is the most important thing for the immune system. And then also to work on your health so you can start lactating. Maybe if it's 3 months, maybe it might work out, but you can get on my healthy version of the ketogenic diet and see if that doesn't help you as well. But yeah, this is not just a milk intolerance. This is just a complete redo on the food that your baby needs. And I would go to the Leche League first. Secondly, if that doesn't work, I would go to the formula that you could, Weston Price Foundation.
Very good, Delia. Thank you so much, and congratulations to your family for your new member. Okay, let's go to Trish from Rumble. Let's see. No, I already did that. Let me go to the next one. Let's go to Kezia, from YouTube. How can I eliminate excess vitamin B6 from my body? I do not take any B6 supplements, but there seems to be foods or something that's causing it to pile up in her. What can we do for Kezia?
Yeah, so I don't know all the details, but of course you want to do a little ChatGPT question the foods highest in B6 and start avoiding those for a while until you can get things back in balance. That's all I'm going to recommend, because I don't know any other details of your supplements or what's happening.
All right, well, good luck with that. And here's quiz question number 3, which asks the audience, true, false, osteoarthritis is merely a wear and tear type of arthritis. And 68% of respondents say that's not true, it's false. 32% say, yep, that's true. Who's right?
So if you look up osteoarthritis, it's just like, oh, just wear and tear. But in practice, I would see people coming in with osteoarthritis, and they're not even using the joint, and it's just disintegrating, and it just kind of breaks down. All of a sudden, you end up with this bone on bone. Like, wait a second, there's something else going on here. And there is a couple deeper issues. Could be a infection from your gum, from a tooth abscess, because maybe you had this root canal long ago. That can actually go in and leach into the joint and create a problem. It can also be that bile situation I talked about. Something going on with your microbiome that you're not able to make the secondary bile, in which case you don't get the benefit of that protection in the cartilage. So I'm going to release a video on that topic soon, so you can watch that. But if you have any type of osteoarthritis, all I'm going to say right now is just support your gut. Start to improve your gut any way you can, to the point where you get back and restore the microbes that make bile. And let's just see what happens to your osteoarthritis.
All right, good luck with that. Here's quiz question number 4, sir.
True or false, seed oils, whether cold processed or heated, still produce similar damage to our bodies?
All right, audience, let us know what you think about that. Okay, let's see. How about Danielle from YouTube wants you to share some advice about those awful eye floaters, I guess she has.
Usually those are shadows of little tiny pieces of protein that are projecting in a certain part of your eye. And one of the best remedies for that would be periodic prolonged fasting. And also, since you're getting this kind of clump of protein, when you do prolonged fasting, your body goes through autophagy and it starts cleaning that up. But the original thing that probably caused it was the combination of sugar with protein, because the sugar was just too high in the diet. So if that's your case, go on something called the ketogenic diet plan.
Very good. Let's go to Ruth from Rumble. That's out of rhymes. Is it true that glyphosate in our foods will decrease testosterone in our bodies?
I absolutely think that, because glyphosate affects your microbes, which can then affect your hormones, and not just your hormones, but your immune system, so many things. So this is, unfortunately, it's used heavily in our foods. And there's, I don't know how many lawsuits. It's like over 100,000 lawsuits now. Or there's actually, I don't know if it's different lawsuits or it's part of a collective class action, but a lot of people are not happy about this. So there's even this social media person called the glyphosate girl. I do follow her. She has great information on the topic.
Interesting. Jan from YouTube, is there a natural way to lower ferritin levels in the blood?
Yes, and that was by avoiding iron in your food supply, like don't cook in iron skillets, do not take iron supplements. And then what you can do is you can up your copper, but make sure your copper is in a copper chelate supplement, so then it's easier on the body. And don't forget, if you take copper for a long period of time without zinc, that could be an issue too. But copper seems to help the safe storage of iron in the tissues. And that's what we're trying to do with ferritin, which is kind of the storage of iron in the tissues. So I'm going to do a separate video on ferritin because there's a lot of false information on that topic, but it's an important biomarker and you want it very, very low.
All right. Good. We'll look for that. Okay. Boy, thank you, audience, for helping us catch up with quiz question number 4, which asks, true, false, seed oils, whether cold pressed or heated, still produce similar damage to our bodies. That is no good. 98% of the respondents say it's true, and 2% say it's false. Who's right?
It's false. Now, here's some data on seed oils. When seed oils, the problem with the seed oil is it's very unstable. And and why is it unstable? Because it's been heated. When you get cold pressed seed oils, and I'm not recommending them, but I'm just saying cold pressed are so much better or so much less damaging than the heated ones, which I'm talking about 99.999% that you buy at the grocery store in the form of the dressings and the mayo, and going to a fast food restaurant or any restaurant, they're already using refined oils. They're not cold pressed, I'll guarantee. And then you're going to heat them in a fryer. And Steve, let me ask you just a side question. What is the legal regulations of how many times you can keep reusing that same oil and reheating it? How many times do you think?
I'm going to use an observational thing at, I won't remember their name, but a fast food joint. The French fries, you can tell they taste different at different periods of time. So my guess is they leave it in the cooker for quite a while, but I don't have an exact number other than my taste buds. And of course, I never eat French fries, but should I? I noticed that.
So there is no regulations to monitor how many times an oil can be used over and over. It's up to the owner. So if you're talking 2 weeks, when you heat this oil, you damage the oil, then you create byproducts. And the byproduct is like super glue, and it's called an aldehyde, and it goes right into your mitochondria. It creates damage in the receptors for insulin, directly causing insulin resistance. So cold pressed is so much better because you're not going to get nearly the amount of aldehydes, right? Until you cook it. So, but what about if you just put it on your salad dressing? Well, that's a heck of a lot better. But and then the other problem is that some of these oils like corn, soy are super high in omega-6 fats. We already have too many of those. There is a type of oil called a seed oil called sunflower and safflower that's high oleic. And if you look at the unsaturated fats in those, called PUFAs, they're pretty low, like 1 to 2 to 3 to 4 or 5% compared to like everything else. So they kind of compare to avocado oil or even olive oil with the amount of monounsaturated fats. So in other words, to make a long story short, if you take a look at all these oils, the high oleic cold process sunflower seed oil might be the best option if you had a choice for something like salad dressing or something like that, if you can't find olive oil, or if you're making mayonnaise, because it's low in the unsaturated fats, but it's super high in the mono unsaturated fats. So it's definitely, if you don't heat it, it's not going to turn into those aldehydes.
Interesting. Okay, in Delia's case with the 3-month-old baby, and she mentioned that there's corn oil. Is there a good corn oil and a bad one, or is it just bad because of omega-6, or what's the deal?
First of all, the corn oils, I mean, I don't even know if you can buy a cold processed corn oil. I've never seen it, but corn is just not the best place to get oil. Yeah, I have not seen it. Cold process expeller type corn oil. I would just stay away from anything related to corn.
All right, let's do that. Barbara from YouTube, can I use charcoal to address histamine issues? And would taking zinc carnoside before meals help with any digestion issues and pain?
You might want to try it, but again, what are you eating? Are you eating something that's creating an immune reaction? There's certain things that increase your histamines, that A1 casein protein in milk would do it. Also, you have certain lectins are called in the wheat products. So grains will do it. Avoid those if you want to eliminate your digestive problems. But zinc would help to heal it after you avoided it.
All right. If your tummy hurts, here's a question for that.
Okay. Which is better? Which is a better antacid? Apple cider vinegar or Tums?
All right, and see, now no true false. Last one, you're going to have to put your thinking caps on. Colette from YouTube, can you please discuss how to prevent getting headaches while fasting?
I really think this is a matter of you just need more sea salt. Take more sea salt. That should turn it off. Maybe you also might need other electrolytes, but I really think it's more the sea salt and than anything else, because I do know that a sodium deficiency will cause a headache. And especially if you're fasting, you're definitely not getting salt. So just beef up the sea salt and see if your headache doesn't completely go away quickly.
It's exciting. A lot of people are talking about fasting, and Mommy G and Kids from YouTube has a question. Is it okay to fast while you are experiencing hormonal fluctuation?
Well, I thought someone was going to ask an easier question, like, is fasting expensive? But let me go back to the question that you asked. I think which relates to, should I do fasting? Can you just repeat that? Because
Yeah, it's wanted to know if she's having hormonal fluctuation. Is that a time you can fast?
So you have your menstrual cycle, you have menopause. I don't think you're talking about that. Maybe you're talking about when they talk about hormonal stuff with the thyroid, should you fast? And because you have to be more specific, but let me just mention that, because that is something that people talk about. You shouldn't do fasting if you have a thyroid problem. When you actually fast, you're telling your metabolism that, hey, we don't have any food. So your thyroid is going to adapt and it's going to become more efficient. And so your T3 is going to go down. And you might think, oh my gosh, I'm getting worse. No, your body just adapting to that state. What's interesting about prolonged fasting is that you actually correct the very thing that keeps your metabolism kind of stuck. They call it a set point, where you try to lose weight and you can't get below a certain amount. That's insulin resistance. So if you fix that, you can then help yourself you can lose more weight. But if you take a look really what a slow metabolism is, it's not a really slow metabolism. It's just a metabolism that is super efficient. So what we want to do is we want you to have an inefficient, a wasteful metabolism. That would be better. And this is why when people do the ketogenic diet, you're burning more fat, first of all, and you're peeing out your fat. That's why your ketones in your urine. you're breathing out the ketones. So it's very wasteful, but it'll help you lose weight.
All right, very good. Let's go to quiz question number 5. And man, instant results and not surprising. It asks, which is better? And good grief, which is a better antacid? Apple cider vinegar or Tums? 100% say it's apple cider vinegar.
100% is incorrect.
Huh?
It's Tums. If we're talking about ridding acid, Tums, hands down, is scientifically proven to absorb and get rid of acid in your stomach. But the big question is, do you really want to do that if you have heartburn? No, because heartburn is really a situation where the valve on the top of the stomach is opening because you don't have the right amount of concentrated acidity in your stomach. So if your goal is to get rid of your acid, then definitely take an antacid, because that will work way better than anything. But the problem is, if you do that, what are the consequences of that? Now we're actually trying to digest protein with less concentrated acid. Good luck. You're going to get indigestion. You're going to get more heartburn problems. You'll get small intestinal bacterial overgrowth, SIBO, which is going to create more gas and fermentation to the point where that pressure, that gas will come up and pop open that valve on the top of the stomach and create more heartburn. This is why the slippery slope of solving your heartburn or GERD or acid reflux with antacids, wow, you go from bad to worse to worse to worse. The longest you should take those as an over the counter is like 2 weeks. I know people that have been on it for years, and I personally think it's a serious problem when you have heartburn, because what's happening is you're not able to digest at the stomach level. And that stomach acid should be between 1 and 3 battery acid to kill off microbes, to prevent microbes from going in there, to actually help you absorb minerals, to help you absorb B12, to help you break down protein. If you can't do any of that, you're going to have a lot of consequences to that down the road. So a really simple fix is to add apple cider vinegar, which is not an antacid, it's an acidifier. But that only acts as a substitute until you could use something even more effective, which is betaine hydrochloride. That's the best thing to add more acid, so then you could fix the stomach situation. I'm ordering a medical textbook from 1947 that has the remedy in there for heartburn and indigestion, betaine hydrochloride. They used to use it in medicine until they came up with Tums, and then they got rid of it. So anyway, just like there was a lot of different high doses of vitamin D3 used in medical textbooks until they came up with the anti-inflammatory drugs. So anyway, I know I went on too long about that. So over to you, Steve.
All right, very good. Well, I think you threw us a couple of really fun curveballs, frankly, with these questions that challenge our reason. Let's try one more question with the time left. We can go over. Panos from YouTube, which diet supplement regimen would you help a 43-year-old premenopausal woman have greater chances to achieve pregnancy?
I think you should focus on 2 things. One is insulin resistance, because that always is interfering with your ability to become fertile because of the high doses, the high conversion from testosterone to DHT. And then also, high doses of vitamin D3. And there's other remedies that people use, like trace minerals, for example, magnesium, to keep that fertility high as possible, and see what happens. On that note, have a wonderful weekend. I will see you next week.